This morning, we are continuing the conversation regarding coronavirus and mental health this morning. We're going to be joined live right now by Dr. Nawalanic from KU Health System. Dr. Nawalanic, thank you so much for joining us early this morning. We know it's an early wake up for you. Let's get right to it so we can get to these questions getting answered this morning. We're about 3 to 4 weeks into this. What is your biggest concern facing the mental health community right now, and what do people need to know most?
You know, I think right now, number one, thanks for having me. I think it's important to have this discussion in terms of people's anxiety and depression, I think, are starting to kind of hit that peak level right now, I think, is where you point out we're 3 to 4 weeks in, which time flies when you're doing nothing. But the best thing is we just want to be checking in with ourselves. Acknowledging the anxiety is going to be one of the most important and first things we need to do, because if we try to repress it, it's going to come out in different ways, whether it be, nasty interactions with our family, turning to substance abuse. A lot of people are drinking a lot more than usual. So you just want to be checking and making sure that you're kind of functioning as close to a baseline as you can.
Yeah.
And if you're not, as pointed out, there are a lot of ways you can reach out for help. There are warm lines, hotlines. You can also just go on Psychology Today, find someone to talk to. So any number of outlets.
All very important there. Another thing that people are curious about is the big question, of course, is when will all of this end? But even when it ends, do the mental health issues end from this, or is this something that could have lasting effects? And how do we start to combat that right now?
That's a really insightful question. I think that right now, if you see people, if you're watching anything that's been recorded and there's a live audience, I think people have a certain amount of, oh, wait, what's going on? And a strange panic, knee-jerk reaction to those, seeing people up close or in groups. And that, I think, is going to fade relatively quickly after this. But the more lasting impacts, I think we are going to see, there are a lot of people that lost a large portion of their lives. People that had to close up shops in their businesses, people that didn't get to go through matriculation ceremonies like graduation as students. And then also, let's not forget the impact of people who have lost loved ones as a result of this disease and weren't even able to be there with them at the end and then have a proper funeral burial service. So there's significant distress that's going to result from this, and I think that we're going to need a lot of help to get through, and it's going to take time for
Certainly.
sure.
Do you think right now that this is a turning point for mental health in terms of getting people aware that they too are struggling when they previously maybe thought they didn't? Is this going to be a trigger for people, or people watching at home right now, should they check in with themselves and ask themselves, am I doing okay?
Absolutely. I think that, there are two things that are really great right now. Number one, technology is at an all-time high in terms of affording access to care in a situation like this, which is absolutely unprecedented. But we're able to see people on an outpatient basis through platforms like Zoom, where we're able to do telehealth and still see people and support them through this time. The other piece that's really beneficial is I think we are at, there's been a lot of move for reducing the stigma around accessing mental health care, and that's going to be crucial in helping us to move forward past this, because in the past people might have been resistant, they might have tried to push it down and bury it and just move on, which is not an optimal response. So I'm hoping that the work that's been done in that area is going to allow people to check in, say something's not right, and reach out for the care they need.
That is an important message. Dr. Nawalanic, thank you so much for joining us this morning. We know you have a lot of information to get out to people, and we could talk about this for hours on end. It's important, but certainly we enjoy the time you've given us today, and we'll follow up with you after the show, of course, to see if there's anything else that we should let our viewers know. So thanks again. Have a good day.
Thank you so much.